Every day in the U.S., thousands of patients go into surgery. They're prepped with standard bed sheets and gel pads. An insecure, time-consuming method that leaves patients open to nerve injury, pressure ulcers, and eye injuries when they wait. It doesn't have to be this way. OpSheet is an advanced surgical bed sheet, a leap forward for patient safety, patient comfort, and surgical efficiency.
I've been an anesthesiologist for 10 years, and I'm a big fan of the OpSheet because I think it adds a lot of advances over just a regular old sheet that most people use for providing a bottom surface for surgery. The Velcro fasteners, I think, are particularly helpful, particularly after a long case where you're a little bit tired and you have a lot of things you need to take with the patient, perhaps the intensive care unit. Arterial lines, PA catheters. Having the fasteners on the sheet allows you to move a patient from the operating room table to the bed.
OpSheet fits most gurneys, OR tables, and tables in catheterization labs and radiology. It buckles to the OR bed to reduce the risk of sliding in extreme surgical positions and saves precious and costly minutes in the OR.
I've been in practice here at the hospital in anesthesia for almost 30 years. I just recently began to use the OpSheet both in cardiac surgical cases and in general surgery cases. One of the best aspects of the OpSheet, which I found, are the multiple Velcro fasteners at the head of the table.
Velcro straps and pockets secure suction tips, IV lines, and other medical equipment.
In addition, it's very useful to have the multiple handles that we have on the OpSheet, as well as the low friction surface, which allows us to, in a controlled fashion, move the patient from the operating room table onto the recovery room bed.
OpSheet's low-friction fabric and built-in handles ease the burden of lateral transfers and reduce injuries to hospital staff.
As an operating room nurse, I like the OpSheet for the built-in arm padding system. It's easier to tuck arms by myself, even on obese patients, and I do not have to look for gel pads.
A patent-pending fastening system comfortably cradles and slightly raises the arms, putting far less pressure on vulnerable nerves. The patient's arms and legs stay secure before, during, and after surgery. Internal padding in critical areas reduces the risk of skin breakdown without cumbersome gel pads.
I'm Dr. Neiman. I've been practicing anesthesia for about 12 years. I've enjoyed using the OpSheet system as it helps me organize the lines and monitors, which improves patient quality and safety. This alone should be a significant push for the use of the product of the OpSheet. I've also found the arm padding system to be very useful in protecting the patient from self-injury during emergence of anesthesia. This helps protect from injuries such as corneal abrasion.
Waterproof and single-patient use, OpSheet lowers the chances of infection and cross-contamination. BCG Medical recently completed a successful pilot deployment of the OpSheet at a major tertiary care hospital in San Diego. Feedback was overwhelmingly positive. Every user in the pilot deployment wanted to use OpSheet going forward.
As a recovery room nurse, I love the OpSheet. It allows for an easy assessment. It prevents the patients from pulling at any tubes, rubbing their eyes. It's a safety issue, and it will prevent them from dislodging any of our critical lines that we have placed in the patient.
I really like the fastening system, the arm securing system, and the leg securing system. My wires are always in place with the straps. I always know where they're going to be. The padding wraps completely around the arms. And I can also, it's very simple for me, even if it's a heavy patient, I can do it on my own. The wires don't stay up against the arm. They're away from the arm while they're on the operating room table. The legs are also secured in place.
OpSheet redefines the standard for OR safety, efficiency, and ergonomics. For the safety of patients and staff, for efficiency in the operating room, it's time to move beyond the conventional bedsheet.